A song of hope to pass time between treatment. These women have been brought together by fate. Here are cancer survivors and their caregivers. They occasionally come together with a belief that a problem half shared is half solved. Courtesy of the Lady Hope Wellness Institute, some can get food and accommodation, while others have their treatment costs taken care of.
When a patient is seen by the doctor, they are told, go eat well, we meet on a certain day. So that patient gets out of that office. They need someone to talk to tell them what the doctor has said, to tell them what is expected of them. So I have Lady Hope Shelter Home, where I tell them to come. I listen to them, and after listening to them, I'm able to assess whether they need further counseling so that they accept their situation. We ensure they get a nutritious meal because cancer treatment is very tough, and if the body doesn't get the light foods, a patient is not able to finish the treatment. It drains the body. So here at Lady Hope, we have supporters who we appeal to give us food, even vegetables, and they're able to eat well.
The skills training offered here also help them redirect their focus from the pain.
Finances are quite frustrating, and they are quite stressing the patients. We would appeal to the government to look into the treatment and at least make NHIF 100% coverage for cancer patients.
Mike Gero is a neck cancer survivor. He was diagnosed with the disease in 2021.
In 2019,
I noticed a small lump on my neck in 2019. I started going to the local clinics and I was given medication with the healthcare providers assuring me that it was just a small growth that should disappear on its own. The problem persisted for a whole year. I was in and out of hospital, but all the doctors would give me are painkillers. In 2021, it's when the growth became bigger until the pain became unbearable. I was diagnosed with neck cancer at Embu Level 5 Hospital.
This was the beginning of Gero's long, painful journey.
I went back home and sold all my cattle to pay for my surgery, which was amounting to 60,000 shillings. However, after surgery, the affected side of my neck was paralyzed, affecting my mouth and eyes.
A disease that Gero thought would leave his body soon after the surgery has now completely grounded him.
I developed eye problems as a result. Money for the regular clinics was a problem, so I skipped the hospital appointments.
Gero has been in and out of Kenya's largest referral hospital since 2021. The treatment is too costly to continue.
At Kenyatta National Hospital, they told me I needed to undergo 36 radiotherapy sessions for the tumor to completely dry up. One session was costing 3,600 Kenya shillings. We began fundraising at home, so I was able to start the session 2 months later. I didn't have anywhere to go. I used to go through the sessions and stay in the wards without anywhere to go. At least now, I have accommodation courtesy of Lady Hope Wellness Institute.
The disease has not only taken away his most precious blessing of good health, but has also deprived him the joy of being with his family.
I have 3 children. One of my children cleared school in 2020. The other one is in Form 3. He reported to school when schools reopened for the first time, but the following day he was sent home for lack of school fees. Another one is supposed to join junior secondary school. He is yet to report to school. I cannot afford to pay for my treatment and their school fees. I cannot do any job at the moment because of my current health status. I do not know what to do anymore.
In 2021, Teresia Wanjiru began experiencing heavy bleeding. Unaware that this was a sign of a life-threatening disease, she initially ignored the signs.
I would bleed thrice a month. This continued for some time, and my assumption was I was doing heavy tasks. I tried reducing on that, but nothing changed. At the hospital, they told me I had hormonal imbalance, so they prescribed me drugs that would help with balancing my hormones, but that didn't help either. I then began to bleed heavily until in a single day, I would use at least 4 sanitary towels. I went back to the hospital, but a referral hospital this time.
Wanjiru was diagnosed with cervical cancer and referred to Kenyatta National Hospital for specialized treatment.
It was not easy. I had lost my sister the previous year from breast cancer, and I was scared my path would be the same.
Wanjiru explains that the disease has not only affected her, but also her entire family.
Radiotherapy 25. I underwent 25 radiotherapy sessions and 4 chemotherapy sessions, 5 days a week. NHIF helped with the 2 sessions, but couldn't pay for other services. We were forced to hold fundraisers. My husband fell into depression. He had to quit his job to take care of me. I couldn't be left on my own.
Florence Musili is a strong believer that one should live a day at a time. The breast cancer survivor is overwhelmed by the cost of treating a disease that started as a small lump but ended up taking away a body part.
I did not take it seriously. I thought it was just like any other disease that can get treated just like any other disease. There are a lot of challenges that cancer patients go through. Money is very critical when it comes to treating and managing any type of cancer. My husband died last year from pressure after I was diagnosed with colon cancer. It has not been easy.
Priscilla Wambua, who is a breast cancer survivor, has skipped 2 months of her doctor's appointment due to lack of money.
I have sold all my property. Now I am helpless. I'm only pleading for help with the treatment. It is not easy managing this disease. Most of the time, we borrow from friends to take her to the hospital when she's not feeling too well.
For someone like Priscilla Wambua, who is already struggling to get the basic needs for her family, that is food, good shelter, and clothing, managing breast cancer is not only a health problem for her, but a financial burden that she cannot deal with at the moment unless well-wishers intervene and help with the treatment cost.
Most of them are not able to pay the consultation, and I'm able to support a few with the consultation. Other times there is medication to buy. When they find that there is no medication at Kenyatta Hospital, they are told to go outside and buy medication. If it's for chemo, they get back to Kenyatta to be administered. That is really, really frustrating because they can take even a number of days before they get the money required to buy the medication.
The costs of treatment for cancer is very high. And if you look at most people who have gone through treatment, even with the various interventions that the government has, you look at between 3 million to 10 million. So depending on the type of cancer, depending on whether you have NHIF, depending on where you go. So between 3 to 10 million is actually how much one spends. How many people can be able to afford that? You know, that is always the big question. And that's why, you know, after treatment, most cancer patients they become bankrupt. You sell property, you do Harambes, and still it's never enough for most people. What also now makes it even worse is that NHIF, much as it covers some of these costs within cancer treatment, they don't, for example, cover the diagnostics. Now, if you're to go for chemo, you cannot have chemo if they've not done diagnostics. So they need to do blood works, they need to do liver function, they need to do kidney function. NHIF does not cover that. So yes, it may be covering your chemotherapy, but it doesn't cover your diagnostics. So even now, for you to be able to go now and have your chemotherapy, some people cannot be able to afford, because again, the diagnostics, depending on where you go, are anything between 10 to even 20,000 shillings every month until you finish your course of treatment. So again, it becomes a challenge for many people. Then we even go now to the issues of other tests that you do, bone scans, MRIs and everything. The costs are also very high. So basically within cancer treatment, the costs are very, very high.
According to the World Health Organization, WHO, many cancers can be cured if detected early and treated effectively.
The government should look at making cancer treatment free for all, just like the way they've made HIV. If they made cancer treatment free, even those that are refusing to come to the hospital at the grassroots, they are saying, what is the need of being screened? What is the need of starting treatment if I'll fall out along the way? That way, the government will have helped. And another thing is about awareness programs. There are people without radios, without TVs, who need to hear what to look out for so that they go for the screening. And those others, we need to tell you don't have to be sick to be screened. So awareness is very, very important. Once I help these patients, I tell them their role in the cancer fight is to create awareness. And they are ready to do that at the grassroots. But then we have to empower them. A hungry woman can't get out there to go create awareness. So with the skills empowerment training we are giving them, we are hoping that supporters and even the government can hold them and start income generating projects for them so that they are able to tell others that cancer is not a death sentence.
In countries where health systems are strong, survival rates of many types of cancers are improving thanks to accessible early detection, quality treatment, and survivorship care.
We would like to see a more inclusive oncology package from NHIF. A package that covers the whole cancer journey. So it doesn't cover some aspects of it and leaves out others. So that is one of the things that we would want to see. Or better still, just like we have seen within the HIV and AIDS space, would also want to see even treatment free, right? So that would help a lot. That is one. Then number two, some of the government is trying in terms of availing some drugs which are free. But then there is also a challenge with that. Out of the 100 essential drugs required, only 23 are free. But then again, most of the times they are not available, So again, can they make this, they're out of stock. So can they work to ensuring that these drugs they are giving out for free are available to the cancer patients? Then in terms of the rehabilitative commodities, people who have gone through breast cancer surgery, they need prostheses. So can government help with that? These things are expensive. People who have gone through colon cancer, they need colostomy bags. So some of these things, if they can be made available to cancer patients, then that again would help a lot. Then palliative care. From diagnosis, not just towards the end of somebody's life. If that can also be made available, then that would also help. We've also realized there's another challenge in terms of the human resource within the oncology skill set. So the human resource, be it nurses, be it doctors, is very limited. Yeah. So if again the government can work on ensuring we have adequate human resource with oncology skills from the nurses to the doctors, then that would also be able to help a lot.
Cancer is the third leading cause of death in Kenya and the second leading cause of non-communicable diseases after cardiovascular diseases. The 2020 National Task Force report further reveals that the annual incidence of cancer is increasing and was reported at 47,887 cases in 2018 and 42,116 in 2020.
We've realized that cancer patients are being discriminated a lot at their places of work. Because many times, especially during treatment, you tend to be away from the office. Maybe you're going for radiotherapy or you're going for chemo, and before chemo, you're also going to do your blood works. So most employers do not understand. They think you're an absentee employee, and so you become a victim. If we can only have people within the family setup also not discriminating against cancer patients, then that also helps a lot. Then we also have issues to do with like, for example, the disability cards. From 2016-2017, as an association, we began advocacy on cancer patients getting disability cards. And I'm happy to say that from that time, we have raised awareness, people have taken it up, many support groups have taken it up, and now we are seeing many cancer patients getting disability cards. However, even with the disability card, there are still some services you're not able to receive, okay? And even for you to get that disability assessment, some hospitals you still go, you don't have one breast, but they still do not give you the disability card. And yet, with your breasts cut off, and with your lymph nodes removed, then your hand is affected. You're not able to perform economically. So basically then you qualify to be treated as a person with disability. So can we have the government also treating patients with cancer as persons living with a disability, and then all the benefits that come with it, including tax exemption, because they can use that money to buy their medication, yeah? So including tax exemption, then can that be done for cancer patients? I think that would be a very good step towards supporting cancer patients.
The key to the cancer fight is awareness, especially through the participation of the youth, because we know the earlier we capture it, the better. So we are trying to involve youth groups to get into the cancer awareness programs so that they can pass the word as fast as possible. They are in many social media platforms, and if they pass the cancer message well, we'll be able to make a big difference. So the government can have cancer programs in schools so that those kids are empowered as early as possible.
We request the government to hold the hands of cancer survivors because the treatment is such an expensive affair.
According to the World Health Organization, cancer is a leading cause of death worldwide. The most common are breast cancer, lung cancer, colon, rectum, and prostate cancers. Around 1/3 of deaths from cancer are due to tobacco use, high body mass index, alcohol consumption, low fruit and vegetable intake, and lack of physical activity. Additionally, cancer-causing infections such as human papillomavirus, HPV, and hepatitis are responsible for approximately 30% of cancer cases in low and lower middle income countries. The most common cases of cancer deaths include lung cancer, colon and rectum, liver, stomach, and breast cancer.
People still go to the hospital when it's a bit late. So by the time you're going to the hospital, the diagnosis, is maybe at stage 3, stage 4, and most people, by the way, they never come out of it. If you're diagnosed at stage 4, so many people, they don't come out of it. They die. So there is that late diagnosis, and then 2, sometimes there is also the misdiagnosis by the doctors. And I always like giving an example of especially stomach-related cancers. So you may be presenting with stomach issues, acidity and everything. So you go to the doctor, you're given antacids, they do many things. But at that particular time, they still do not diagnose that you have cancer. So you keep on getting treatment for other things. By the time they get to know it is cancer, it is too late. Yeah? So that misdiagnosis is also another problem. Then, when you're diagnosed with cancer, mentally, if you don't take it positively, people get into a depression. And if you don't have a positive attitude in whatever situation you're going in, then that also has an impact on your healing process. So again, people die. Yeah. Then we also have something new that has been coming up. People are committing suicide, you know, high cost of treatment. I'm getting metastasis cancer, so people are committing suicide. So we've been seeing a few cases of late where people are committing suicide because of cancer-related issues.
While Kenya has a universal healthcare system, many public hospitals neither have the resources nor staff to provide adequate treatment. Cancer patients are often the most vulnerable. Purity Musenzuki, KTN News.